We talked about the American Health Care Act before Congress really took it up in earnest. How did you react when House Republicans decided not to bring it to the floor for a vote?
Well, I thought it provided an opportunity for us because I think that we're probably not doing what is the root cause of our problem. We've noticed that healthcare continues to increase in cost, really driven by two things. First of all, more older people, and secondly, more things we can do for people. And rather than talking about how we move the money around to different groups, I think what we really need to do is to look at how we might reduce the cost of healthcare and keep the curve from going up. And this is something that's not just a problem for us, it's a problem across the country, across the world, I should say. So there are really two areas that you can begin to deal with that begin to reduce the cost of healthcare. The first is how we look after sick people. And the second is how we keep people from getting sick. And each one of those has things that you can do both legislatively and administratively to improve the cost of health care over time. And I think that that really is where we should be focused our attention rather than changing in a major way the Affordable Care Act.
To what extent do politics keep that out of focus? You listen to lawmakers from Cleveland or from Washington, where you are today. What's keeping them from talking about these particular policy issues in earnest?
Well, I think that's a very good question. I think we've gotten down into the weeds a little bit of how the law is actually administered, and I think we would be much better if we thought about how we could begin to deal with the root cause of our problems. And I think, not being a policymaker myself, I think that you'd have to ask that question to people who are actually involved in Washington in the legislative process. Their real only major sword that they have is legislation, and I think that that's what they're trying to do, and I would direct them to a different way of looking at it.
You're not a policymaker, but you interact with a lot of them. You're a hospital administrator, you're a doctor. Why is consensus so elusive when it comes to healthcare policy in this country?
Well, we are dealing with the same thing that almost every other country in the world is dealing with. If the United States, we look at how we're moving to increasing federal payment. Medicare and Medicaid and no pay now account for 62% of the patients we see at the Cleveland Clinic, and going up 1 or 2% a year. And so we're moving increasingly in the United States to government pay. And in Western Europe, we're moving in the opposite direction to more and more emphasis on privatization of healthcare. So I think there really is no sort of perfect situation. And we have a very major industry which is growing up in a fragmented segment. So I think we're going to take some time to be able to sort this out, and I don't think there's an easy answer to it.
Republicans have talked about rolling back the 10 essential health benefits requirement that's in Obamacare. Just explain to me what that would mean for both health care and insurance coverage if that were to disappear.
Well, I think that's an unfortunate, would be an unfortunate move. And I think one of the things we don't realize particularly is if we reduce the coverage of people, those people, for example, the 14 or 20 million people who will lose coverage under the current suggestions of a bill, that is going to have a major ripples across the entire healthcare delivery system. Because last year, 52% of the hospitals in the United States lost money on operations. And if we have a great number of patients who are not going to have anybody pay for their health care, this is going to put an increasing financial strain on hospitals across the country. Granted, we have too many hospital beds in the country right now, and probably in excess of hospitals, but we do not want to put 50% of the hospitals in major financial problems.
What can you tell us about the direction of this strategic and policy forum that's been convened by Steve Schwartzman, chaired by Steve Schwartzman? What have you guys discussed? When are your next meeting, and what's on the agenda for all of you?
Well, the next meeting is going to be on April 11th, and it's a wide variety of things going all the way from education to commerce. We're breaking up into groups to begin to deal with those and meeting with people in the various portions of government that are appropriate for those discussions, and then meeting with the president after that.
I imagine that part of that conversation is going to center on the budget. You had the White House presenting a skinny budget here that called for some cuts. When you talk about reform in the context of health care, how worried are you about cutting back funding, say, to national science organizations?
Well, I'm worried about cutting back on the National Science Foundation. I'm also worried about cutting back on graduate medical education. We have a shortage of doctors in the United States right now. We're a net importer of physicians from all over the world. And if we cut back on postgraduate education or graduate education, we're going to find that we're having a bigger and bigger shortage. We're short about 100,000 physicians by 2020. So I'm very concerned about that. I also think that our future is around science and the development of new technologies. We have a lot of unsolved problems, things like Alzheimer's and autism, major issues, and we need to continue our research projects along those lines. Research financially always pays off in the long run in reducing costs.